Thanks so much, Padma, for the invitation, and it's just been really great to be back there and listen to all these different presentations and really learn about the scope of such an important disease entity, and also meet some of you and talk to you and learn just in the back there. So how's everyone doing? I have the exciting honor, I guess, and privilege, and also kind of not the greatest spot, right? Because everyone just ate lunch and it's a beautiful day, and I'm kind of standing in between you and some other fun things. So I'll try to mix it up a little bit. As you'll see, I'm a bit out of the box, so we'll try to keep it kind of fast moving. Just so you know, Padma is also a good friend of mine. She happens to be almost like a sister-in-law. She is related to one of my roommates in med school, which we figured out after we'd already met. So small world, but really just, I think she's taken this on and done a beautiful job today. So hats off, Padma. So I'm going to put this actually in, let's see, slideshow mode. So, all right, so as Padma mentioned, I am board in integrative medicine, but I'm a Western trained neurologist. So hopefully I'll give you some sort of fun tips of both sides of the world. So I get to give the usual last spot talk. Usually it's the last day. Everyone in the doctor world has already left. They're on their way to the airport, and I get the fabulous, non-pharmacological approaches sort of talk. However, patients are usually very interested in this talk, so it's my honor to speak to you about this today. So complementary and alternative medicine, which has sort of now been retermed integrative medicine, has had really, I think, some fun ride. And you happen to be in Arizona, just up the road in Tucson or down the road or whatever the geography is. There's a lot of great folks doing things at the University of Arizona. And I've really sort of taken kind of an interesting approach. I think I grew up in a household where my mom was a family doc, always had a lot of Ayurveda sort of approaches in our household. We practiced some yoga, I meditated. I really leaned on some of these practices in my own life, and then I sort of ended up learning more and more. But, people are always laughing, like, what is this Reiki crap? What are you guys doing to our patients out there? So I think, we really have to kind of rebrand. And so just, there is an entity at the NIH which studies integrative approaches, and these sort of cover this gamut of different things that I'll sort of hit on. So it includes things like exercise, manual therapies, massage, things like that. The mind-body practices kind of in the banner overriding some of this stuff. I'll talk to you about meditation, yoga, things that are near and dear to my heart. There's also some things around psychological approaches, mental health, which I think is so key in so many different types of disorders that we take care of, and very important to talk about a little bit. And there's also the nutritional aspects, so what you put in your body, diet, supplements, things like that. And then there's a number of other things, quote unquote natural products, including botanical drugs. And when Padma asked me to give this talk, she was like, basically everyone just wants to hear about pot. So I was like, okay, well, we'll definitely cover that as well. So we'll sort of hit on all of these things. And thrown in here it's a huge industry, actually. So this is an old slide, actually. I just looked at the website for the NCCIH, and this comes from 2012. But a lot of patients are looking at a lot of these sort of things out in the world. So most people in Parkinson's, for example, 60% of our Parkinson's patients are looking at complementary and alternative approaches, and lots of people in society are looking at all kinds of therapies. And so there's actually this cool article I found about folks like you who gathered in the UK for a National Blepharospasm Patient and Public Involvement Day. And I was speaking to some of your leaders here about doing something similar with you to survey what your interests are, what makes a difference for your quality of life. Because I think we as doctors can all sit in a room and talk about what our research priorities are, but if it doesn't impact you, then we really haven't served you well, right? So this was a paper that was published in 2019. And as you see here, alternative treatments are the number one thing that was suggested as a top research theme, along with a number of other things. And when we look at what really affects patients in this group, there's about, I think, 100 people surveyed, things like losing independence, thinking about what other people's assumptions are of them. So this real stigma of like walking down the street or just sitting at a dining table in a restaurant and wondering what people are thinking about them. This is something that really affects people, and probably you too if I asked you. Driving, activities of daily living, and other things. So, there's a list of things here that I think we can kind of explore together. And then when we think about treatment and what the hope of research is really going to be, again, complementary and alternative therapies really, again, win the day there. So I think really we have to kind of listen to you, do more research, and really sort of take this field and move it forward. So I'm really a Parkinson's doc. That's what my bread and butter is. And Padma didn't mention this, but I run our VA Center of Excellence in Parkinson's. But I'm trained in movement disorders and have done Botox and treated all kinds of folks with various types of dystonias and abnormal movements. And I think one can't treat this sort of disease state without thinking about the impact of mental health. And this isn't just for neurological diseases, but every disease out there, honestly. And I'd like to sort of posit mental health, things like anxiety, depression, sleep issues, all of these sorts of things, apathy, the things that really impact our daily lives when we ask our patients as something that is a huge problem, and we have a huge barrier to getting help in this arena. We wrote this paper looking at Parkinson's patients, but I think a lot of this stuff is still the same. So there's a huge stigma around even talking about being stigmatized, right? So nobody wants to talk about the fact that they're embarrassed. They don't want to talk about the fact that it creates anxiety, and then that's a stigma. They don't want to be in public because they're anxious now, right? So all of these things can kind of feed into each other. Caregivers are burnt out, family members. We have COVID-19 as well that has been a huge bane in the world, honestly, and affected a lot of mental health. We have scarce mental health resources and really a disparity in care. And I was excited to see that there's quite a diverse group in the room. I usually give talks in Parkinson's disease, and every single person is Caucasian and male. And so I was happy to see the diversity and applaud you for bringing out members from various communities. I'm happy to talk around these issues too, because I really do think that we have to serve not just a very niche population of affluent people with good insurance that can come see us in our urban centers, but really everybody who's suffering with these sorts of diseases. So I want to posit to you a little bit of a different model, this wellness model. And so classically, we have a very different sort of approach to health, but wellness is really the active pursuit of activities, choices, and lifestyles that leads to a state of more holistic health. And this can be looked at not just in things like blepharospasm or oromandibular dystonia, but Parkinson's, and pretty much everything that affects healthcare in general. And so it's really important, and what we realize as doctors is that we are not the whole drivers of health. And actually, when you as patients feel like you're part of your treatment and you guide us with what matters to you, that puts you in control, and actually your outcomes are actually a lot better when we do that. So it's important to think away from this medical paradigm where you have a symptom, you have a complaint, you come and see me episodically once in 6 months, I stick an injection in your face, and then we meet again in 6 months. Sometimes that's the solution, but for a lot of people, that's just part of the larger health issues that they're dealing with. And really, there's sort of this sense that they want to be part of the solution. They want to have something to do every day that they can wake up and think about that drives their health, and it's just not a corrective sort of model where I'm in control, but that it's really about we and you telling us what matters. So I work at the VA, I just told you that, and really the VA has actually been quite open-minded to some of this concept. And so some of the things that we'll be talking about in that sort of more holistic approach are not just a pill, not just a toxin, not just a surgery, but this sort of lifestyle approach. And so there's a number of these bubbles here that you're going to see, and I don't think this pointer's worked since the beginning of the day, so I'm not sure why I'm trying to point it here. But anyway, so we have a number of things, and including things like exercise, diet, spirit and the soul, things like social connection, sleep. All of these things can actually affect how your general health is, and then that can then affect how your symptoms of blepharospasm or whatever your issues are. So really, I think we have to think more holistically. And when we're thinking more holistically, it's not a cookie cutter approach to just one shop fits all. It's really that we meet you where you are as a person, try to understand what matters to you, what types of things you want to be doing in your life. And for each of you in this room, it may be very different. For some of you, it might be playing with your grandchild. For some of you, it might be golfing. For some of you, it might be trying to climb Mount Everest. I don't know. So we really have to understand what health means to you and cater to you. Additionally, what we're realizing, and I was speaking to one of your crew here today, and they were talking about how women specifically are worried about things like menopause and how that might affect some of their symptoms. And I think we really historically studied largely Caucasian men, and it doesn't matter what disease state, across medicine we're studying this in, and so we have to do better. And so being culturally competent is really important. So thinking about how race affects things, how where you live affects things, if you're a woman, if you're a man, all of these things, if you're, have means, if you have good insurance, all of these things can be very important for how we deliver care. And we wrote a paper, and believe it or not, Parkinson's has a lot more attention than a disease like Blepharospasm, for example. However, even in Parkinson's disease, it took until 2022 to actually create this drawing on the right here, which includes the menstrual cycle, includes things like menopause, and thinking about this as making it important as research priorities to factor in things like hormonal cycles and changes in women so that we can cater to people, not just the same sort of treatment for everybody, no matter who walks in the door. So this is something that we want to bring to every disease state, and really thinking not just about, again, Caucasian people, but people of color, people of LGBTQ, whoever it is, catering to them, meeting them where they are, and understanding what matters to them. So as Padma said, I have got boarded in integrative medicine, and what this is really sort of the borderland between Western medical approaches, which I absolutely believe in. In a disease state like blepharospasm, botulinum toxins are actually hugely key. And to talk about alternative treatments without actually acknowledging that is not an intelligent thing. Just like in Parkinson's, we have great medical therapies, but they don't take care of every patient or every aspect of the disease. So I think we can be open-minded to see what else is out there. And I think this type of approach really fits the definition that the World Health Organization came up with in the 1940s of health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So it's not just patients, so I showed you that it's a patient priority to care about integrative approaches or alternative approaches. Medscape Neurology, I had an interview with a colleague of mine for Medscape, which is a way that we educate doctors, and it turned out that my interview with Dr. Lefevre, talking about my concepts of integrative medicine and my training, was the most watched show of these types of interviews last year in 2021. So neurologists are hungry for this. Every doctor out there, I think, is starting to get more open-minded. So I think it's important to start talking to your doctors to try to see if we can work together and not hide some of the ways that people, and often patients do seek these approaches because they're interested and then they don't communicate well with their doctor. So it's really about a team-based approach. You saw today so many different folks that are working together here in Arizona to deliver care, and I think it's about really all of us working together, the patient voice, these sorts of patient support organizations, and then every type of person on your team, which I'll show you who can be on your team in a minute. So as I mentioned, these sorts of approaches include things like purpose, sense of meaning. So it's important for you to think about what really is your health priority. What brings you joy and meaning? How can we do more of that? I talked to you about the mind-body approaches. So contemplative medicine is this thing, mindfulness, meditation. People are like, what is this crap? Like, what are you guys doing to our patients? Well, I spent the last year learning about contemplative medicine, which is really this approach using things like the Buddhist philosophies, for example, of teaching meditation and incorporating this in healthcare. I spent the last year on a scholarship learning with 30 other healthcare providers about how we can use some of these approaches, like mindfulness. And really, it's not just sitting on a cushion meditating for 20 minutes. There's a whole host of these things. You may not be able to see this very well, but this tree looks at all kinds of approaches that you may find that you're already doing. Things like prayer, things like maybe yoga, things like singing, dancing, journaling, all kinds of things that you may already be doing. And so we want to make some of these things really approachable. And so different cultures have some of these things already. So getting out in nature, being on a hike with beautiful things around you, observing beautiful flowers, taking the time to smell the roses. These sorts of things all count for some of these mind-body approaches. So maybe you can look at this list and pick one of these things that you may already be doing, make a commitment to doing more of that. So I have a passion for yoga. People are always like, what is yoga? I don't even understand what this is. I go by the mall, there's all these yoga clothes being sold. It seems to be all these sort of ballerina types contorting themselves into crazy sort of pretzel-like poses. And really, this is an ancient practice. It really has very little to do with exactly what I just showed you. And yoga really means union, and it was sort of part of this more larger banner of Ayurveda, which is this healing science and lifestyle approach in India. And it looks at including things like poses, movement, breath, and meditation. And in 2016, this was a huge multi-million-dollar industry in the US already. Lots of people were doing yoga. But then we started in medicine trying to understand how to study this. And we've really looked at this across a number of disease processes now. And there are good studies looking at a number of things. And where I think really are the place, especially in a disease state like Blepharospasm or Parkinson's, is really in this bottom line here, which include things like mood, sleep, stress, pain, things like that. Even cognition can be helped by yoga. So I think keep an open mind. There have been studies of people doing yoga even into geriatrics populations. And this gentleman right here, BKS Iyengar, brought yoga over to the US when he was in his 20s. But when he was 16, he was actually very close to dying from a pulmonary problem of tuberculosis. He could barely walk down the street, let alone do these poses. And he really rehabbed himself using yoga. And then when he was in his 60s, he got into a rather bad car accident and then was able to use modifications to really practice yoga in modified ways and rehab himself, and he just passed away, I think, almost at the age of 90. So really, I think, embodies sort of this approach to being able to use something like yoga to help not just the body, but the mind in this more holistic way. So from a blepharospasm specific thing, we're able to use things like meditation to cope with general stress or with stresses associated with the condition. There's also the ability to sort of take a break from what we're doing. I think we heard about using too much screen time, right? We're all sort of stuck on watching TV, watching our devices continuously, and that's definitely not good for your eyes. So can we use some of these things to sort of take a break from the screen time, take a moment to get out, maybe for a walk, do some yoga, use some breathing things. All of these sorts of things can help kind of the general stressors. So as I mentioned, Dr. Weil in the University of Arizona, one thing that's actually very accessible to all of us is actually this 4-7-8 breathing. Has anyone tried this? I see a bunch of hands in the room. Yeah, so it's actually pretty effective. So basically what you do is you take a deep breath in and count to 4 when you're breathing in. We could do this together, but unfortunately, Dr. Mahat asked me to cover a whole bunch of extra topics today within this. So maybe at the end, if we have some time, we'll try to do it together. So you take a deep breath in with your mouth. At the top of the inhale, you hold it for 7 counts. And then you breathe out very slowly. You breathe in through your nose. Then you breathe out slowly through your mouth for the 8 counts at the end. So 4 breaths through your nose slowly, 7 counts at the top of the inhale, and then 8 counts through your mouth slowly again. And so you're sort of pacing, making these inhales and exhales longer. And then you're sort of using this way, and it actually is a very powerful way to tap into the autonomic nervous system. And that is the quickest way to sort of reset that fight and flight response. So it's important to practice this so it's available to you whenever you need it, but I actually needed an MRI myself for my neck, and I was using this in the MRI scanner when I was about to have a panic attack. Having ordered MRIs on hundreds of patients over the last 20 years, I myself, Dr. Subramanian, was about to have a panic attack in the MRI scanner. So this stuff works, I can tell you. So I want to pivot a little bit to another topic that's near and dear to my heart, and that is that of social connection. So you wouldn't really think this is something that should be included in a presentation like this. And don't worry, we'll get to the pop part at the end. I'm saving the best for last so you don't all leave on me. But loneliness is something that's really very important for all of our health, and it's actually a basic human need to be socially connected, just like food, water, and shelter. And when you have something like blepharospasm and the stigma that I already showed you, that fellow patients like you have talked about, we tend to isolate, right? We tend to be like, I don't want to be a burden. I don't want to be seen. I don't want to have to worry about what this person's thinking about me. I'm just going to stay home. Parkinson's patients do this as well. And then we entered COVID-19, right, with lockdown and social, sort of distancing and all that stuff. And so many of our patients, including my parents and other people in society, have really gotten used to spending all of their time indoors and really isolating. And this is a huge problem because social isolation, loneliness, it's worse for you to be lonely than if you smoke a half a pack of cigarettes a day or if you're obese. So that's really bad, right? And it actually is a high predictor of getting dementia if you're lonely. And if you're lonely, you're not alone, because even before the pandemic, 40% of patients in society who were above the age of 60 said that they were lonely. 40%. So it's a very common problem, and it puts you at much higher risk of all kinds of things. So what does loneliness actually mean? So social isolation is something I can measure. I can see who you live with, who you talk to every day. But loneliness is this undesirable subjective emotional state in which I have a need, I have a want to have certain types of relationships in my life. And then the relationships that I have aren't exactly what I want. And so it's that felt gap between what I want and what I desire and what I actually have that is really this sort of felt sense of loneliness. And so it's actually very common. And in order to not be lonely, it's actually important to have contact in 3 spheres. So one is this intimate sphere that we have a confidant at our home, maybe a caregiver, a spouse, a wife, somebody like that. Then there's this relational sphere of connection where we have some friendships outside the home, maybe a tribe of 5 people that you talk to on some semi-regular basis. And then outside of that, there's a need to connect in the community or with society on a sense of purpose. For some of my veterans, it might be being a veteran. It may be, for some of you, being part of this Blepharospasm organization. But all 3 of these spheres actually have to be met in order to not feel lonely. And so you can be happily married, but still feel lonely. And you can be lonely as a couple together. So I really want you to think about this. How much social connection are you having? Because this is a huge determinant of a number of things. So loneliness leads to stress hormones going up. It changes your immune function. It can change your cognition and actually put you in a space where you're much more hypervigilant, you're much more worried, much more paranoid. You fixate on things that are socially threatening, and it can also mess up your sleep. So what we've been doing in the Parkinson's world is really trying to raise awareness about loneliness, but actually throughout the VA, we're talking about this because loneliness in veterans increases their chance of suicidality, of depression, anxiety, and substance abuse. So these are things that we should be asking all of our patients, no matter what they're suffering from. So I ask you to ask yourself this. Do you sometimes feel left out? Do you sometimes feel isolated from others? And if this is true for you, think about those 3 spheres of connection and think about how you can proactively reach out to others and maybe try to connect. And so what we want to do is try to sort of think about not just this for us as the person perhaps who is a doctor, but also for caregivers as well, who may be taking care of our patients at home. For many of you, you've had a long sort of standing time, maybe with your loved one alone, isolating at home. And so really think about how we can use some of these wellness strategies, not just for the patient, but also for you caregivers in the room as well. I urge you to read these books. They're great resources on this loneliness topic, and this one by Norina Hertz is quite mind-blowing. It just came out. But Vivek Murthy, who's our Surgeon General, also wrote a book that's a couple of years old now. I actually ended up becoming so passionate about this, I got invited to do a TEDx talk on the negative impacts of loneliness, so you can check out my TEDx talk. Now, coming back to some other practical solutions for blepharospasm, there are some ways that you can do some massage techniques. There's 1 or 2 that we can talk about. So massaging the cheek, jaw, and gum. And this is more for the oral mandibular sort of dystonia type patients. Some of these, sometimes you can kind of palpate around and find places that are tight, and then you can kind of massage yourself using a pointer finger. I'll show you in a second if you have blepharospasm, a way that you can do this if you have blepharospasm as well. There's also ways to use a warm compress on your upper face and eyes. This has been proposed. Most of these things have not been well studied. These are just examples of things that patients have taught us about. Here's something from WikiHow a lot of, unfortunately, information about blepharospasm for my lecture has been not well vetted. So some of it just comes from Googling and using things like WikiHow to see what other people have come up with. So this is a diagram that I found of some ways that you can do an acupressure massage and various touch points, starting at one and then going across the eyebrow and then coming down to the inner canthus there. So you can kind of follow along there. It's just important if you're going to do these sorts of things that your hands are clean and that you stay away from inside the eye itself, because we don't want to cause an infection. And for some people, this may actually exacerbate things. I've had patients say some of this stuff does help, and then other people say that it's not so helpful. Other patients have talked about sensory tricks, so sometimes using a headband. Some people have reported that a tight headband or baseball cap can reduce symptoms around their eyes. Pressing the fingers against the temples, the end of the nose, other facial locations. I just showed you a picture of some other things. Closing your eyes and positioning your head back sometimes, or looking down. Varying head position can help. Sometimes putting something in the mouth, chewing gum, whistling, humming, singing, sucking on a straw. These may help. Sometimes just distracting, reading aloud. Lots of patients have prescribed different things, have found different things. And so really when we think about this multidisciplinary approach, looking at these various things you can do, it's also important, you may not be able to see this that well, to think about all the people on your team that may include people ranging from speech therapists, physical therapists, yoga teachers, all kinds of folks, support group leaders, and even colleagues and folks, friends like you talking to each other in this sort of place can actually be very, very helpful. So I think it's largely about dialoguing and keeping an open mind and seeing what works for you. I did look into some specific physical therapy interventions. This was the only study I could really come across, systematic review of rehab in focal dystonias. Unfortunately, in this huge table, so they looked at a number of things like increasing exercise, constraining exercise, all kinds of different ways of using neuromodulation, using different types of movement strategies. But unfortunately, they didn't specifically comment on either oromandibular dystonias or blepharospasm. But I think we can all think about ways physical therapists may be able to be helpful. And then this was another paper looking at the role of a speech pathologist and what they may be able to help with. And they're actually able to sit down and talk to you sometimes if you have issues in the speaking with oromandibular issues. And they're able to spend some time talking about how this affects your quality of life, what specific things in your history and in terms of daily life activities may be teased out, what types of safety issues may be affected, how it affects your speech. And so these types of folks can actually work with you to look at safety issues. So if you're having vision issues, perhaps seeking an optometrist or ophthalmologist to test your vision, to be able to see how you're doing. And then a physical therapist or an occupational therapist can also assess things like safety of swallowing, safety of movement. They can spend some time teasing out your quality of life, trying to understand what types of activities of daily living are affected, helping you to find sensory tricks perhaps, or helping you to refine the sensory tricks, finding assistive devices like a toothpick or some other things. If you have issues with swallowing, help modifying the diet if needed. And for swallow issues, finding compensatory strategies or swallow issues can sometimes be helped by head positioning as well. So these are some things that sometimes some of these allied health professionals, which we consult on a regular basis and are big fans of using in the multidisciplinary team, are helpful. And then from a technology perspective, we were talking about screen time. So really, especially with things with the eyes, going to a dark place, sitting quietly, not thinking about anything in particular, sometimes trying to relax forcefully. Okay, I just gotta relax, Why can't I relax? The more you think about relaxing, sometimes it can actually make you more stressed out. So I think distracting yourself, focusing on something like the breath, or just trying to think about something else altogether can actually be pretty helpful. In terms of your computer setup, think about the ergonomics, thinking about keeping enough distance from the screen, thinking again from a smartphone use, not holding your phone too close to your eyes, aiming for a distance of 12 to 14 inches. And in general, just putting that screen away, getting out in nature, trying to get some natural light, all of these things can be pretty helpful. Switching to Ayurveda, there's actually some techniques you can actually use, I guess, that have been tried in India. None of these have been well studied, but there are some things from an Ayurvedic perspective that have been written about, including things like delivering certain therapies in the nose that can be put through oils. There are practitioners that specialize in this, so I urge you, if you are interested in looking at this, to include the full healthcare team to talk about it, see this person, come back, and then discuss it with your doctor so that nothing harmful is given. And just in reading about blepharospasm, so there's these different doshas, and the doshas sort of are elements of different sorts of, every one of us has something after you can actually figure out what your dosha is, and then try to help yourself with certain types of dietary practices. And so with blepharospasm, apparently in Ayurvedic traditions, there's a sense that people have a little bit more vata in them. So Ayurveda is not just taking specific supplements like turmeric. It's really a much more holistic sort of lifestyle thing. There are some supplements that I was able to find on the internet, things like ashwagandha, brahmi, things like that, that have been written about, but there really are not great studies on any of these things. So again, discuss it with your healthcare team. I looked into acupuncture. There's been a little bit of information on acupuncture. Basically, these people, this is largely from traditional Chinese medicine in which needles are used in certain points to see if they can aid with different sorts of issues. I was able to find this paper on the treatment effects of botulinum toxin injection and acupuncture on blepharospasm assessed by the change in lower eyelid tension. So they actually had some device to look at lower eyelid tension in this study. There was about 30 patients between the ages of 37 and 83 that were studied here. And what they found was that patients who did get this, the acupuncture, and I'll show you the points. These are some of the acupuncture points that they used, did seem to have reduction in their lower eyelid tension. So this was one study published in an OK journal. Here's the lower eyelid tension, and we see here some information just comparing the patients with acupuncture on the top and Botox on the bottom. So I asked Dr. Mahant about lower eyelid tension, if it's something that we're measuring in general in people, and it doesn't look like something in general we do in blepharospasm. So I'm not sure exactly how to extrapolate this very well, but anyway, there's some small data. I think more research needs to be done. So looking at diet, I know somebody had asked about coffee this morning already. Generally, they say avoid caffeine, especially coffee, tea, chocolate, and soft drinks. I think many of these things just increase sometimes the flow of adrenaline and get people a little bit more amped up. So anything that amps people up makes people often have extra movement. I think that's largely where that comes from. Certain nutrients, such as magnesium, may help symptoms of blepharospasm. Magnesium in general calms down muscle firing, and we do use it as a muscle relaxant in some patients. So this might be something you can talk to your providers about using. And then if you know that there are certain medications that cause this in your armamentarium or even recreational drugs, then don't take those. But it's really, there hasn't been a lot written about this. Now coming to the pot part, I know this is the part that everybody's actually been waiting for with bated breath, right? So who in this room is interested in this topic? Okay, like everybody, okay. All right, so I am a federal employee, just so you know, so I generally don't talk about this, but I do know some things about it just in general from my integrative medicine topics. So cannabis refers to basically all products derived from plants of Cannabis sativa. And there's basically 540 chemical substances that includes. Marijuana refers to parts of or products from the plant cannabis that contain substantial amounts of THC. So THC is a tetrahydrocannabinol. And THC is a substance that is primarily responsible for the effects of marijuana's effects on mental state. So we're able to sort of have these plants, and then we're able to look at things like CBD, so cannabidiol, and then THC, so CBD and THC. There's a sense that people who take THC, because it's sort of this less psychoactive component of this plant, that they're safer from a number of side effects that can affect cognition, and that THC products are much more cognition-based. However, when you buy commercially available products, these are not FDA approved or regulated generally. if you go to a dispensary. And so it's very, very hard to know exactly what you're getting. And much of these things that say it's this percent of that and that percent of this, nobody really knows. And if you go back the next week, you could have a completely different batch that has a very different amount. So even when people say this is highly regulated, it's very hard to know. And in edibles, it's even less hard to, like things that are baked in or cooked in things, they're not well distributed within the product. So it's very, very hard to know exactly what you're putting in your body or your mouth. So there's just been a lot of interest in CBD in general. For pretty much you name the disease, everybody wants to know about this, and Parkinson's too. So we have, I was looking for studies. There are a few studies. There are very, very small numbers in each of these types of studies. So I'll just share with you a few that I was able to find. Most of these are from the last 10 years. So this was in the clinical experience of ophthalmology. This looked at a number of patients, the total number of patients in about 6 studies was 10. You can't read this very well. But the bottom line is that most patients experienced some sort of side effects, many of which were things like vertigo, dizziness, some experienced some cognitive issues, some experienced some lightheadedness, things like that. So pretty much across the board, some patients felt a little bit better, some patients had no improvement, but there were some subjective improvements in some patients with respect to their blepharospasm. So it's a mixed bag of patients. So there were side effects, not a high number of patients in general. Here's another study. I think you can read this a little bit better. So these patients were largely, there's 5 patients in this study. They had the cannabis added onto Botox that they were already taking. And here you can see that some of the patients stopped it eventually. Some of them stopped because of cost. I think 1 or 2 continued it. And largely you see that there was sleep side effects, lightheadedness, things like that again. So a lot of patients have tried it, I think. Not many have been studied in these types of studies. And I think a number of patients have reported some subjective benefits, but also some side effects. So here's another study here. I think, actually, sorry, this is the same one. Basically the subjective responses, did you have improvement? Yes, yes, yes. Things like that. Would you participate in a prospective study moving forward? Pretty much everybody said yes. So I think, we have some taste of just, some basic things that have been written up. Here's another study. I think there was 3 patients in each arm, basically, here. So very, very small numbers. And in this study, I think the 3 patients that took it in the treatment arm seemed to do pretty well. There were side effects even in these 3 patients. They were mild, but patients talked about dry mouth, insomnia, and general fatigue. And so, again, some small numbers with some small benefits. So there is a trial that I was able to find on clinicaltrials.gov run by Rona, I think it's Silkis, I can't remember if it's Siklis or Silkis. And I know that this study was looking at patients and recruitment about 2 years ago. The trial ended about a year ago, but I've still yet to see real sort of data on this. I couldn't find a paper yet. So I don't know if anyone has any updates on the study or participated in the study. You do? Oh, cool, okay. So I don't know if everybody heard that. Apparently she's trying to get it published in movement disorders, and it was funded by you guys. Awesome, okay. Yeah, so I was able to just find sort of the numbers. It was a relatively small number of patients, but it looked like, it did sort of finish its using Epidiolex, and the patients took 100 milligrams in the treatment arm for 3 months, and then the placebo arm was on placebo for 3 months. And they were looking at eye blink analysis from high-speed video camera recordings was the outcome, as well as some blink amplitude and some other measures. So I guess to be determined what the results are. Okay. There's no taste of the answer. We can't, no cheating. I guess we'll have to wait for the paper to come out. So I think that was pretty much my last slide. So not a ton of information on blepharospasm specifically, but yes, we have a lot of research to be done. So thanks so much for your attention. I'm not sure about the timing, but happy to, I guess, stay up here.